And then regulatory and vascular are very similar. Regulatory medicine is more alternative medicine. In other words, the classic regulatory medicine is acupuncture. It re-regulates the body. It's not based on anatomy and biochemistry. It's based on physiological regulation of systems. Electroacupuncture, some of the machines we use in our office, like the Moore machine, these are all re-regulating machines. They re-regulate the body, the physiology. And then most what we do, because we combine all of these in our treatment, is we attack the underlying vascular cause of what's happening, the circulation cause. Now, in circulation disease, that has now segregated itself, and it's kind of self-segregated itself if you watch the medical literature over the years. The large vascular disease, today called macrovascular, are the large vessels in the neck, the aorta in the abdomen, and the legs on the surface of the heart. These are the arteries that they operate on and put stents in, put grafts in, replace them, whatever they're doing today. And that's versus the microcirculation. Now, microcirculation is new thinking. It's the small vessels. You could arguably use the term capillaries, because all capillaries are microvessels, but not all microvessels are capillaries. So they're not quite synonymous. But for the average person, capillaries is good enough. Because what we found, and that's going back to these heart studies, when I realized the way chelation is working is it's doing something in the microcirculation. Because if you go back to macrocirculatory disease, it's always bothered me when I was in training where you could take a patient that had a stroke, for instance, and you could look at these arteries in their neck, and this artery may be 100% blocked, and this artery is completely open. And you look at all these theories, smoking, cholesterol, blood pressure, how does that work if this artery is blocked and this artery is clean, since just as much cholesterol, high blood pressure, whatever you're looking at, it's going down both same arteries. And what doctors are taught to say, to parrot, to do this, when somebody says, how does that work? You're taught to say, well, atherosclerosis behaves as a skip lesion, which means it hits one artery and skips another, which is sheer rampant sophistry. Why don't you just say you don't know? Because then you can learn something. But when you just make stuff up, what's a skip lesion, so we're not going to look at it anymore? Nobody looks at it anymore. But that always bothered me, especially doing cardiovascular medicine, because it never made sense. The system is basically focusing on macrovascular disease. Interestingly, in the last, I want to say 10 years, there is a realization that microvascular disease may be driving a lot of these problems. But the debate going on in the literature today, in the vascular literature, mainly in cardiology, as opposed to cardiovascular surgeons, is how do we measure this? How do we measure it? So they know it's wrong, but they can't see it, because you can have what Braverman, which we'll get to in a minute, Braverman calls in her book microvascular angina, sometimes called syndrome X, and no standard cardiac test that they do today will pick that up. Cannot pick it up. If a cardiologist is smart and he's doing an echocardiogram and he sees what's referred to in their language today as abnormal diastolic dysfunction, lucitropic dysfunction, that is synonymous with microvascular disease in the muscle, heart muscle itself. But they just do the same things that they do for macrovascular disease. Same drugs, same whatever. Because it's just very narrow thinking what they do. What we're concentrating on in our office is microvascular disease.